Good afternoon. My name is Ana Espinosa and I'm going to be your nurse today. How are you doing?
Great, thank you.
So what is your name?
Christopher Espinosa.
May I see your ID band, please?
Yes.
Okay, Christopher. All right, so what I'm going to do today is I'm going to be doing a head-to-toe assessment, and that involves touching you. Is that okay with you?
Yes.
All right, so then what I'm going to do now, I'm going to gather my equipment. I'm going to go wash my hands. In the meantime, I'm going to provide you with privacy. I'm going to make sure there's nothing here that can make you fall. I'm going to shake the doctor's orders, and I'll be right back, okay? Thank you.
Great, thank you.
Knock.
Come in.
All right, I wash my hands. I just put on some gloves. And so I'm going to, like I said, I'm going to be touching you. If at any time you don't feel comfortable, you just let me know, all right?
Yes.
Okay, so I want to assess a couple of things that I want to know. So tell me, what am I doing here?
You are here to assess me for my physical exam.
Perfect. And do you know where you are?
I'm currently at the doctor's office.
Perfect. And who was the last president of the United States?
Donald Trump.
All right, so now what I'm going to do is I'm going to be assessing, I'm going to do like a little review system just by asking him subjective data, okay? So tell me, do you have any pain right now?
No.
Do you have any history of headaches?
None.
Do you wear glasses?
Nope.
Hearing aids?
No hearing
You have
aids.
difficulty breathing?
None.
Any problem with your mouth, sores?
No.
Any problem with your throat, swallowing?
No.
Any problem with your chest, conditions of like heart problems or pulmonary disorders?
None.
Like pneumonia? Have you ever had pneumonia?
No, thankfully I haven't.
All right. Do you have any abdominal problems like, hernias or any problem, urinating, any problem like that?
No.
Any problem with your muscles? Any weakness?
None.
History of any problems with any surgeries, broken arms?
No fractures, no surgeries.
All right. Do you have any arthritis?
No arthritis.
Okay. Any problem walking?
None.
Any falling? Any falls?
No falls, thank goodness.
Okay, fantastic. So what I'm going to do now is, now that I have the history, I'm going to start doing my assessment. And I'm going to be looking at his head, and I'm going to verbalize two facial symmetries, landmarks. So those are going to be the eyes and the ears. So the next thing I'm going to do is I'm going to palpate the head and the scalp. And I'm going to be palpating the head. Okay, and I don't see any lesions. I don't see any parasites. Then the next thing that I'm going to do is I'm going to palpate his temporal arteries. Okay, and you're palpating strong. And then I'm going to palpate his TMG, and open your mouth and close. Okay, very good. And I see no problem with that either. So now I'm going to assess his ability to clench his teeth, and smile and puff his cheeks, and that will be a cranial nerve 5. So can you clench your teeth? Can you clench your forehead? And can you puff your cheeks? Okay, and the next thing I'm going to do is I'm going to assess cranial nerve 7. So I want you to squeeze your eyes, wrinkle your forehead, and smile. Okay, so now I'm going to be testing his eyes, the external ocular movement, external ocular movement, which are cranial nerve 3, 4, and 6. So what I'm going to do is I'm going to have you follow my pen. And I want you to not move your head, but follow my pen, okay? So go ahead. You appear to have no problem with the intraocular muscle, and I just assess cranial nerve 3, 4, and 6. So the next thing I'm going to do is I'm going to assess his visual field by confrontation. And I want you to hold this card against your right eye. Your left eye. Your eye should be the same as mine, okay? And then I'm going to just looking through the eye that is not closed, and just tell me how many fingers I have. Just
2.
looking at me.
1, 4, 3.
Okay, thank you. Very good. Okay, so the next thing I'm going to do is I'm going to do pupillary response, and I'm going to do direct and consensual. And I'm going to come across with the flashlight, and I'm going to assess his pupil. I'm going to assess his left pupil, and the right one should constrict, by consensual. And I can see that this pupil is constricting, and the other one is constricted by consensual, okay? So the next thing I'm going to do is I'm going to be assessing his ears, and I'm going to be assessing the auditory nerve 8, I'm going to be assessing, to see if he can hear. So by doing that, I'm going to do the whisper test. I'm going to whisper 3 words in each ear, and he's going to tell me if he can hear or not.
1, 2, 3. 1, 2, 3.
All right, so it appears that Christopher has absolutely no problem hearing. So the next thing that I'm going to do is I'm going to look at the appearance of the ears. So the ears look, symmetrical. They don't appear to have any drainage, and there's no pain when is there any tenderness here? So there's no pain when I touch, the astragus, the tragus. So the next thing I'm going to do is I'm going to inspect the nose, the internal position of the nose for any deviation, shape, size, color, and any discharge. Okay, so it appears to be symmetrical in the center. It doesn't appear to have any septum deviation. The nostrils appear to be good. So I want you to touch one side of the nose, squeeze, okay, and then breathe, and then do the other side of your nose, and then breathe. So he appears to have no problem breathing at all, and the nostrils appear to be patterned. So the next thing I'm going to do is I'm going to assess the mouth. I'm going to inspect the lips, the gums, the tongue, including the base and floor of the mouth, his teeth, the oral mucosa, and the posterior pharynx. So I'm going to be doing this by using a tongue blade, which I don't have one now, but I'm going to assess the oral mucosa. Open your mouth. So the gums appear to be moist. Open your mouth. I'm going to, if I had a tongue blade, I will press down and I will make him say and I will be assessing the uvula raise and the hard palate. So the posterior pharynx look good. So there's no cracks in his lips. Everything looks moist and everything looks good. He has all his teeth, so there's no problem that way. I'm going to now take advantage and have him checked also for cranial nerve 12. I'm going to have him stick out his tongue and move it from side to side, and that's cranial nerve 12, okay? So, and I did assess, cranial nerve 10, which was, the raising of the uvula up and down. Okay, so the next thing that I'm going to be doing is I'm going to be checking his neck. I'm going to be checking his neck. I'm going to be checking his thyroid gland, anterior, right and left side. And I can do it 2 ways. I can do it from the anterior or I can do it from the posterior. I'm going to demonstrate by doing it from the posterior. So I am going to assess, I'm going to be looking at each side. So I'm going to be touching here. And because the thyroid is hard to palpate unless it was swelling, I'm going to have you do some swallowing. Okay, when he did swallowing, the thyroid went up and I was able to palpate. Also, I'm looking at his tracheal, and his trach is midline, and there's absolutely no deviation, okay? So then the next thing I'm going to do is I'm going to be palpating his lymph nodes. I know that the lymph nodes are not palpable unless they are swollen. So if they're not swollen, you won't be able to feel it. But you palpate the lymph node with the pad of your fingers, okay? So here we have the preauricular, and then postauricular. We have the submandibular. We have the submental. We have the cervical chain, and we have the subclavian lymph nodes, okay? So once I palpate that, then I'm going to go ahead and start assessing his pulses, okay? And so I'm going to be assessing his carotid pulse. I'm going to be assessing his brachial pulse. I'm going to be assessing his radial pulse. And we do this on both sides because we want to make sure that we do this symmetric, okay? And then if I want to, I can actually auscultate the carotid artery for any bruising, okay? So with my stethoscope, I can, I dropped this, so I'm going to clean it with alcohol, and I'm going to clean it with alcohol. So I'm going to auscultate the carotid artery with a bell. And I hurt, no bruise, okay? So now what I'm going to go ahead and do is do the neurological examination. So what I want to do is, if you can stand up for me, Mr. Christopher. Okay, so I'm going to have you rotate your head against resistance and do the other side. And I want you to shrug your shoulders up. So I just assessed cranial nerve 11. So then the next thing I'm going to do is I'm going to have him sit back. And I'm going to be assessing the rest of the cranial nerves. I'm going to be assessing now the upper extremities, fine motor. So I'm going to have him do the thumb to finger. So I want you to use your thumb and touch every finger, against your thumb. And that is your upper extremity fine motor coordination. Okay, then I also want you to do is I want you to grab your hands and pat your knees with your hands, and that will be also exactly that will be continue with your rapid movement. Okay, so then I want you to touch my finger, touch your nose, and then touch my finger. Okay, again and again. Okay, so he had that coordination as well. So we did the rapid movement with the thumb and the fingers. We did the finger to one of my fingers, and then we did the finger to nose. Okay, so now that we have done that, we're going to continue with the neurological assessment. And the next thing I'm going to do is I'm going to assess his lower extremities, his fine motor function. So what I want him to do is I want him to do shin, heel to shin. Perfect. I want you to do it on your other extremity. Very good. Okay, so he was able to do that. Then the next thing I want to do, so he was able to do shin to heel, and heel to shin. Yes. Okay, so now the next thing that I'm going to do is I'm going to assess his reflexes. And I'm going to start with this upper reflex. And of course, I don't have a hammer with me, so I'm going to pretend that this is my reflex hammer, okay? So I'm going to get his upper extremities, and I'm going to let it hang like this, and I'm going to be holding it like this, and I'm going to hit the bicep, and he should have the reflection of that will be that he will extend his arm. So let's see. Oh, okay, so it's working. Perfect. So the next thing I'm going to do is I'm going to be testing his lower extremities. And what I'm going to do is I'm going to palpate the knee, and I'm going to go right in the patella, and I'm going to hit him with my hammer once again, and he should have extension of the leg. Yes. Let me do the other one. Yes. Perfect. 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 Okay. So now I'm going to use vibratory sense of the greater toe. So what I'm going to do is I'm going to use my turning fork, and I'm going to make it vibrate, and I'm going to see if he can feel this vibration on his toe. Okay, so I'm going to vibrate. Can you feel the vibration?
Mm-hmm.
Okay, let me do the other one. I'm going to vibrate. Can you feel the vibration?
Mm-hmm.
Perfect. Okay, so the next thing I'm going to do is I'm going to set the position sense. And what I want to do is I'm going to have him close his eyes, and I'm going to move his toe in different directions, and he's going to tell me which direction I'm moving, okay? So, Mr. Espinosa, am I moving your toe up or down? Okay, what about now?
Down.
Okay, I'm going to do the other one.
Up. Down.
Okay, perfect. Okay, so now I want you to stand up for a minute. Perfect. And I'm going to perform the rumbar test. And you're going to put your hands beside you. And I'm going to close your eyes. I'm going to be standing by you so that you won't fall. And so he had no problem with the rumbar test. He came and taking himself stable. So the next thing I want you to do is I want you to walk. You can open your eyes, and I want you to walk, in the room. Just walk across the room. All right, and now I want you to walk by walking by heel to toe walking. Perfect. Now I want you to sit back again, because I'm going to be assessing your lungs and your chest, okay? So now that I have you in position, if you can just take your jacket off, please. I'm going to try to provide you as much privacy as I can. And the first thing I'm going to do is I'm going to be looking at your lungs. I'm going to evaluate to make sure that is symmetrical, that there's no lesion, there's no scar, there's nothing. So I'm going to percuss to evaluate the CVA. So I'm going to go in the back and I'm going to hit. Do you have any pain?
No.
All right, so the next thing I'm going to do is I'm going to instruct you to breathe in and out. Please open your mouth during inspiration. And I'm going to be assessing your lungs. And the first thing that I'm going to do is I'm going to palpate, okay? So I'm going to palpate to make sure that I don't see any masses. So I'm going to palpate, I'm going to palpate your lungs. And a palpation includes under the axilla as well, because your lung goes all the way down here. And I'm going to do that in both sides. I'm also going to do it in the back. I'm going to palpate the back of the lungs. And remember that there's a lot of lungs in the lower back. That's where most of the lungs are, okay? So after I palpate the lungs, I'm going to then do some percussion, okay? So I'm going to percuss. And what I intend to hear, percussion will be to make sure that that I don't hear any flat notes, okay? Also, I'm going to auscultate the lungs now, okay? So I'm going to have it breathe in and out. And, okay, breathe in, out, in, out, in, out, in, and of course I'm going to go all the way to the side. I'm going to do it on both sides, and I'm going to do the same thing that I did in the front, I'm going to do in the back, okay? So the next thing I'm going to do now is I'm going to assess the heart, and I'm going to be looking at the chest again, and I'm going to feel to see if I feel any thrills, around the valves. If I feel any thrill, point of maximum impulse. So we have here aortic, pulmonic, we have the earth, the tricuspid, and the mitral valve. And the mitral valve is, where you have the point of maximum impulse, okay? So now what I'm going to do is I'm going to, palpate, palpate, palpate. I don't feel any masses. And then the next thing I'm going to do, I'm going to auscultate, okay? So I'm going to auscultate the heart. And I'm going to start with the aortic. You can breathe normally, aortic, pulmonic, earth, tricuspid, and mitral. And it's notable to say that S1 is here louder at the apex of the lung, the atrioventricular closure, and S2 is here louder in the base of the lung through the aortic pulmonic valve close, okay? So the next thing that I'm going to do is I'm going to now assess his abdomen. All right, so I want you to lay back in position in the bed. If you could please lay for me. And do you have to go to the bathroom?
No.
Okay, so I'm going to do now is I'm going to remove his clothes just a little. I'm going to provide him a lot of privacy. So I'm going to only expose the area that I'm going to be looking at, okay? So right now, I'm going to, the first thing that I want to do is I want to auscultate. And why do I want to do that? Because I want to make sure that I can hear the vowel sounds without having to do any percussion or any movement that could alter the normal pattern of the vowel sound. So I'm going to look at the abdomen, and the abdomen looks flat, it doesn't look round, it looks absolutely fine. And then I'm going to auscultate. I'm starting with the right upper quadrant, the right lower quadrant, the left lower quadrant, and the left upper quadrant. And then the next thing that I want to do is I want to, now I'm going to auscultate. I'm going to now palpate, and I'm going to start with light palpation, moving up to deep palpation. So I'm going to start with light palpation. Do you have any pain?
No.
I'm going to go light palpation, no pain, and now I'm going to go with deep palpation. Any pain?
No.
Deep palpation, deep palpation. Okay, so I did light palpation and deep palpation, and he has no pain. So what I'm going to do now is I'm going to percuss, okay? So, okay, and I didn't hear any dull sounds or flat. I hear timpani. So the next thing I'm going to do now is I'm going to palpate his vascular sound. So I'm going to palpate his aortic, which is right here. And I can do it with the diaphragm and also with the bell. So I'm going to go ahead and do it with the belt. So we have the aortic, we have the iliac, the renal, and the femoral. So I'll palpated all his arteries, and they're okay. So if I wanted to palpate the spleen, it will have to be swollen, because other than that, the spleen is totally non-palpable. And you know that we have the heart is on the right, on the left side, so the liver is on the right side. So if I wanted to palpate the liver, I will go down here to the end of the thoracic cage, and down here, you know, is where the liver would be if I wanted to palpate the liver. Okay, so now that I done all this assessment, I'm going to let you know that I'm finished. Mr. Espinosa, I'm done with the assessment. Do you have any questions?
No.
Well, everything appears to be normal. I will be talking to your doctor about it. I will be doing the documentation, and I'm going to be leaving now. I'm going to leave the call light, you know, within reach. Do you want me to draw the curtain? This is a private room, or you don't know? Okay, so you have no questions?
No questions.
So I'm done with this assessment. Thank you so much, and have an amazing day.
Very nice
All right?
to meet you.
Thank you. It's a pleasure. All right, thank you.